look at the stay-at-home orders, does it send the hair on the back of your neck standing when we talk about locking people at home, especially as we're approaching the month of June, when we know people need to be outside, we know they need to be exposed to the fresh air and the sunshine and UV rays. We know what viruses do and how they respond. They die effectively when they're exposed, at least this one does from the studies that we know, that they die when they're exposed to UV rays. Yet we have governors saying, hey, you got to stay indoors, possibly indefinitely. They keep moving the goalposts, right? Now we're hearing mid-June. But we also have evidence that this, and a lot of evidence, that this virus is in the neighborhood of 18 times more transmissible indoors versus outdoors. And that most of the studies we're seeing, the recent one just today out of Scotland that affirmed another study out of China, that most of the cases outside of these nursing homes were being transmitted between family members, effectively, people who are living together and not out in the general public and not at work. So as a doctor and a logical thinker, does it bother you like it bothers me what we're seeing happening and what we're doing to healthy young people in this society?
It bothers me a tremendous amount. Let me just interject. I left New York on a whim to drive to Georgia with my wife and some of my children because I had to get out of it. My kids were not mentally doing well, and it was just time for a change. So we did that in hopes of moving things forward when we came back, and we just went from a tremendous open state. People are going to the beach. I sat on the beach on Wednesday, and I'm thinking how nice this sun is for this virus. People weren't wearing masks on the beach. People who wanted to be there were there. And then we come back to New York, and we're in a whole different situation again, almost stepping backwards.
And so
yeah.
Again, as a doctor, this must really gnaw at you, no?
It gnaws at me a lot. I think we were well prepared. I think we did what we were asked to do. I think, as the cliche is now saying, we are constantly moving the goalposts.
Can I talk to you about one more thing? And again, this is the empirical evidence, and this is what I try and focus on this program, are the facts. And then I give, obviously a little bit of my interpretation of them. But this is antibody testing out of Spain. So these are the raw numbers that I would imagine exist in this country, but we're not being exposed to these numbers, doctor. And these data on here, if you parse through it and you look at the left-hand column, which is the age groupings, and then you just look at the right-hand column, which is the mortality rate. Effectively, doctor, if you're aged 0 to 20, it's almost statistically zero that you're going to die from the Wuhan coronavirus. If you're aged between 20 and 50, it is at or below the mortality rate of the flu. So when we step back and we look at the totality of what we have done in the great state of New York, what we've done in California, what we've done in Illinois and many of these other blue states, as well as red states, and you look at the mortality rate, this data exists in this country, yet we're not getting it from the CDC, and we're certainly not getting it from the mainstream media.
I agree, and I think antibody testing has not really shown what we expected it to show. I think it's showing that a lot more people have been exposed to this than have not been. I can tell you an interesting anecdote is that in our hospital so far, the healthcare workers who've been tested have been more negative than the population outside the hospital. You would think that the hospital is a place where people, when this was at its peak, would be most apt to get it.
And there's a very real chance that a lot of these hospital workers, including yourself, have developed the antibodies, through herd immunity, being exposed to the thing. Possibly a lot of folks had the virus. We know that in many cases they're asymptomatic. And in your own little microcosm there, you may have developed a herd immunity.
That is correct.
That is correct. And it's, again, being overlooked by most of the politicians, especially in these blue states, and certainly by the mainstream media. Dr. Miller, thank you.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.